Pneumonia, a hidden lungs infection, could be silently shutting down your breathing, and most people don't realize it until it's too late. Pneumonia, a hidden lungs infection, could be silently shutting down your breathing, and most people don't realize it until it's too late. Welcome to WA Health and Care. Today, we're uncovering the truth about pneumonia, a dangerous lung infection affecting millions across the UK and USA. As Dr. Sarah Jarvis explains, early symptoms are often ignored, but quick action can save lives. Stay with us to learn essential signs, risks, and treatments. What is pneumonia? Pneumonia is a serious lung infection that affects the air sacs in one or both lungs. These tiny air sacs normally fill with oxygen, helping your body breathe and function. But during pneumonia, they become filled with fluid, pus, and inflammation, making it difficult for the lungs to deliver oxygen to the bloodstream. According to Dr. Hilary Jones, a well-known medical specialist in the UK, pneumonia can escalate quickly, especially in children, older adults, and individuals with weak immune systems. Pneumonia can be caused by different types of microorganisms, including bacteria, viruses, and, in some cases, fungi. In the United States, experts like Dr. Anthony Fauci have highlighted that viral pneumonias often follow the flu or other respiratory infections, while bacterial pneumonia can develop suddenly and become severe within hours. Both forms can be dangerous if not identified and treated promptly. Common symptoms include high fever, persistent cough with mucus, chest pain, difficulty breathing, fatigue, chills, and sometimes blue-tinged lips due to low oxygen levels. Many people mistake early pneumonia for a simple cold or flu, which is why awareness is essential. If breathing becomes harder, or symptoms rapidly worsen, medical attention is urgently required. Pneumonia spreads through respiratory droplets when an infected person coughs or sneezes, making winter months and crowded places high-risk environments. At WA Health and Care, we emphasize the importance of early diagnosis, timely treatment, and preventive steps such as vaccinations, hand hygiene, and maintaining a strong immune system. Pneumonia is treatable, but delaying care can lead to complications such as sepsis, respiratory failure, or long hospital stays. Understanding this condition, recognizing symptoms early, and seeking help quickly can protect you and your loved ones from severe illness. What are symptoms of pneumonia? The symptoms of pneumonia can range from mild to life-threatening, depending on the person's age, overall health, and the type of infection. According to Dr. Sarah Jarvis, a leading UK medical expert, pneumonia often begins with symptoms that resemble a common cold or flu, making early detection difficult. However, as the infection spreads deeper into the lungs, the symptoms intensify and become more serious. One of the most common signs is a persistent cough, which may produce thick yellow, green, or even rusty-colored mucus. Many patients also experience shortness of breath, as the inflamed air sacs restrict airflow and reduce the lungs' ability to deliver oxygen. This can make simple activities like walking, climbing stairs, or even talking feel exhausting. Fever is another major symptom. Pneumonia can cause a high temperature, combined with severe chills and sweating. In the USA, specialists such as Dr. Richard Besser highlight that a sudden, sharp fever often indicates bacterial pneumonia, while a slower, gradually rising fever may suggest a viral cause. Chest discomfort is also common. Patients may feel sharp or stabbing pain that worsens when breathing deeply or coughing. This pain happens because the lining around the lungs becomes inflamed, making every breath feel heavy or painful. Other symptoms include extreme fatigue, headaches, loss of appetite, and confusion, especially in older adults. Some individuals may develop blue lips or fingertips, a sign that the body is not getting enough oxygen, and this requires urgent medical attention. At WA Health and Care, we remind viewers that pneumonia symptoms should never be ignored. If coughing persists, breathing becomes difficult, or fever continues for several days, immediate medical evaluation is essential. Early treatment prevents complications and improves the chances of a fast, full recovery. What are causes of pneumonia? Pneumonia can develop when harmful microorganisms enter the lungs and trigger inflammation in the air sacs. According to Dr. John Hopkins, a leading pulmonary specialist in the USA, the causes of pneumonia differ based on age, immunity, and lifestyle, but the outcome is the same: the lungs become overwhelmed, making breathing difficult. One of the most common causes is bacterial infection, especially Streptococcus pneumoniae. This type often appears suddenly, bringing high fever, productive cough, and chest pain. Bacterial pneumonia is more likely to affect older adults, smokers, and people with chronic medical conditions. In the UK, Dr. Sarah Jarvis explains that bacterial pneumonia often follows a cold or flu, attacking the lungs when the immune system is already weakened. Viral infections are another major cause. Viruses such as influenza, RSV, respiratory syncytial virus, and even COVID-19 can lead to viral pneumonia. This form tends to start gradually but can still become dangerous, especially for children and elderly individuals. Viral pneumonia spreads easily through coughing, sneezing, and close contact, making winter months particularly high risk. Less commonly, fungal pneumonia occurs, especially in people with severely weakened immune systems. Certain fungi found in soil, bird droppings, or damp environments can infect the lungs when inhaled. While rare in healthy adults, it can be serious for cancer patients, transplant recipients, or those on long-term steroids. Pneumonia can also result from aspiration, which happens when food, liquids, or stomach acid accidentally enters the lungs. This is more common in people who have swallowing difficulties, neurological conditions, or impaired consciousness. At WA Health and Care, we stress that understanding the causes of pneumonia helps people take preventive steps, such as vaccination, hand hygiene, and strengthening the immune system. Knowing how pneumonia begins is the first step toward protecting yourself and your loved ones. What are preventions and precautions for pneumonia? Preventing pneumonia begins with strengthening the body's natural defenses and reducing exposure to infections. According to respiratory specialists across the UK and USA, one of the most effective protective steps is vaccination. The pneumonia vaccine and annual flu shot help reduce the risk of severe lung infections, especially in older adults, young children, and people with chronic health conditions. Maintaining strong hygiene practices is also essential. Regular hand washing, sanitizing commonly touched surfaces, and avoiding close contact with sick individuals can significantly lower the chances of catching viral or bacterial infections that can lead to pneumonia. In public places, especially during winter, taking extra precautions such as using tissues when coughing and wearing masks in crowded areas can provide added protection. A strong immune system plays a vital role in prevention. Eating a balanced diet rich in vitamins, staying hydrated, and getting adequate sleep help keep the lungs healthy. Avoiding smoking is one of the most important precautions, as smoking damages lung tissue and increases the risk of both bacterial and viral pneumonia. For those with chronic conditions like asthma, diabetes, or heart disease, following medical advice and taking prescribed medications on time is crucial. These conditions can weaken immunity and make infections more severe if not managed properly. At WA Health and Care, we also advise people to seek early medical help if they develop a persistent cough, fever, or difficulty breathing. Timely diagnosis prevents complications and allows treatment to begin before the infection becomes severe. By combining vaccinations, healthy habits, and early action, pneumonia can be effectively prevented and managed. What are treatments and medicines for pneumonia? The treatment of pneumonia depends on the type of infection, the patient's age, and the severity of symptoms. According to leading respiratory specialists in the UK and USA, early and accurate treatment is the key to preventing complications and ensuring a full recovery. At WA Health and Care, we emphasize the importance of timely medical attention, as pneumonia can worsen rapidly if ignored. For bacterial pneumonia, doctors commonly prescribe antibiotics, which begin working within 48 to 72 hours. Some of the most frequently used medicines include amoxicillin, azithromycin, and clarithromycin. In more severe cases, stronger antibiotics such as ceftriaxone or levofloxacin may be required. It is essential to complete the full course of antibiotics, even if symptoms improve early, to prevent resistance and recurrence. In cases of viral pneumonia, antibiotics do not help. Instead, treatment focuses on antiviral medications and supportive care. For viral infections like influenza-related pneumonia, doctors may prescribe antivirals such as oseltamivir, Tamiflu. Rest, hydration, fever control, and breathing support are crucial. According to American pulmonologist Dr. David Price, severe viral pneumonia may require hospitalization, especially if oxygen levels drop. Fungal pneumonia, although less common, requires specialized antifungal medicines. Drugs such as fluconazole, itraconazole, or amphotericin B are used, depending on the type of fungal infection and the patient's immune status. These cases often need close monitoring by specialists, particularly in individuals with weakened immunity. Supportive care plays an important role in recovery. Doctors often recommend fever reducers like paracetamol or ibuprofen, along with cough medicines that make breathing more comfortable. Staying hydrated helps thin mucus, while breathing exercises and steam inhalation can support lung expansion. Patients are advised to avoid smoking, cold air, and strenuous activity until full recovery. Severe pneumonia may require hospital treatment, including intravenous antibiotics, fluids, and oxygen therapy. In critical cases, patients may be admitted to an intensive care unit for ventilatory support. UK experts such as Dr. Sarah Jarvis highlight that delayed treatment is one of the main reasons pneumonia becomes dangerous. At WA Health and Care, we remind viewers that self-medication is unsafe. Only a qualified doctor can identify whether pneumonia is bacterial, viral, or fungal and choose the correct medicines. Completing treatment, following medical advice, and attending follow-up appointments are essential steps to ensure full recovery and prevent long-term lung damage. Thank you for watching WA Health and Care. Pneumonia becomes deadly when symptoms are overlooked, so awareness is your strongest protection. As Dr. David Price advises, early treatment prevents critical complications. Don't forget to like, share, and comment which health topic you'd like us to cover next. Your health matters.